Hi, I'm Michael Adams, and I'm here with Melinda Adams, founder and CEO of Three Waters Behavioral Health. Today, we're going to talk about some programs at Three Waters that should be of interest to the community. Melinda,
Yes.
where is Three Waters located, and how long have you been in operation?
Okay, well, we have been in Claremont County for just about 8 years, and currently we have an office at 754 Cincinnati Batavia Pike, or Old State Route 74, very near the mall.
Okay. Can you highlight some programs and services that you feel folks should know about?
Sure. Over the years, we have been primarily focused on outpatient addiction treatment, but over the last 2 years, we are now licensed to treat individuals with mental health. So we do SUD treatment, we do treatment of mental health disorders, and in addition to that, we have a couple high intensity programs. We offer partial hospitalization,
Okay.
and we also offer intensive outpatient treatment. And for those programs, we do have housing as well. So we have a house for men, and that house is off of Mount Carmel Tabasco Road, and then we have a female house in Milford. And so our goal is to kind of stabilize people, because over the last 8 years, we have seen that it's hard to really engage people in treatment when they are couch surfing or when they're in active use. And so our purpose is to have the most natural home environment for them, where they can stay there up to 6 months
Okay.
and engage in treatment.
Wow. Okay. So I was going to ask about some barriers to treatment, and it sounds like you covered some of it. What do you? Why is housing? You know, why is that a big part of the treatment programming?
Well, the housing is not a necessary. You don't have to live in our house to engage in treatment. But what we have seen is people that are in active addiction, they don't have housing. Most of them are homeless, and they are living with friends, living in, on the streets. There's no real stable environment where real healing can happen. And so that is one of the barriers that I've seen over the last 8 years. And I'm thinking, what can we do to shift that paradigm a little bit? And so that's what we've done. So we've been doing high intensity treatment for the last year, and we have seen some remarkable outcomes as a result of that. And not to mention, Michael, we are the first program of its kind here in Claremont County.
Wow, that's awesome. So let's talk a little bit more about the intensive treatment services. Who is this program designed for?
That's a really good question. High intensity treatment is really designed for individuals that are just stepping out of active addiction, and some of them may have used that day of enrollment. So it is really for people that um, are really struggling um, in the moment, the here and now, and our program is primarily geared for those people that have used within the last um, week or even the last 30 days.
Well, what about people that are maybe just being released from incarceration?
That's a great question. We know that when individuals are incarcerated, we know that they're not always sober, and it's easy to stay somewhat sober when you are in a protective environment. So we don't count incarceration time as clean time. They've only been clean while in jail, so they haven't had an opportunity to really establish themselves in an environment where they're exposed to their DOC, which is their drug of choice,
Okay.
and did that answer your
Yeah,
question?
yep.
Okay.
So how do folks pay for their treatment?
Great question. Typically, this level of care is really based off of a treatment authorization from insurance companies. So you have to have insurance, and it has to be approved for you to seek treatment here. Now, I will say this: we have treated a lot of people over the years that maybe have had insurance, lost insurance because they've gotten better. So, yeah, and if they don't have insurance, what we will try to do is connect them and get them what's called presumptive eligibility here in the state of Ohio that will allow us to treat them.
Okay. What insurance do you accept?
Primarily Medicaid.
Okay.
We are working on the VA benefit. So we are working on insurance through the VA, and we are also opening that up to other commercial insurances. But right now, primarily it's Medicaid products.
Okay. Okay. And you mentioned the housing program and that folks could stay there for up to 6 months. But how long does the program last?
Well, the program itself is about a 4 to 5 month program, and there's just the level of intensity for the high intensity. We're looking at approximately 30 to 60 days in that level of care, and then they would step down to a lower level of care, um, which is so which is IOP, which could be up to about three months or so
Okay.
for that.
Well, how long? How do folks progress in treatment?
Well, that's a really good question. Well, I think progression in treatment is really about meeting the treatment plan goals and objectives. And so all clients that engage in our program, they are on what we call a treatment plan. So that treatment plan guides what it is that we do with that client, and it's very individualized. It's based off of the goals that they want to attain for their life. It could be reunification with their children. It could be living on their own, housing, education. There's all kinds of different you know treatment goals that our clients are actively working on, and the other the major goal is that they can live in community sober, and they can produce clean screens, and they come to treatment, and that's how you progress in treatment. That's probably what you're getting at. Okay, so our program, if you're living in our house, now here's the caveat to that. I don't ask them to pay for the housing. Michael and I personally fund the housing program. They can live in a house, but the requirement is, as long as you're living in the house, you have to remain sober, and you have to come to your treatment. And if you aren't doing those things, then it's really kind of hard for us to keep you in our house, because
Right,
it's taking an opportunity away from somebody else who really wants it.
Now, you mentioned briefly earlier that the participating in the housing program is not a requirement for those high intensity treatment programs. I mean, it's separate. The housing program is separate from the treatment program.
Yes.
Okay.
Yes.
Who would be eligible to participate in the housing program? Are there criteria for
Yes.
acceptance into the program?
Yes. What I look at, sometimes I'll go to a jail to do an assessment on somebody. And what I'm looking for when I meet that person is this a person who really has a desire to change? Is this a person that can live in community? Is this a person that is ready to make a commitment? And so I kind of look at all of those things, and that's how I gauge whether or not they would be acceptable in the housing program that we have. Now, we do have, some areas where certain kind of behaviors and things like that we kind of look at, and We would not refuse to treat somebody, but if someone has sex-related crimes or charges or arson charges and things like that, we would look at that and think, well, maybe they're not appropriate for our housing program, but that doesn't mean that we would not move forward with providing quality treatment to them.
Okay. Okay. So you mentioned that that it doesn't cost the program participants anything to be in the house, and that we basically pay for it. What about the rules for people who are coming into the program? Like, can they have a phone?
Okay.
Can they have a car?
Okay.
Can they, are they locked down?
Okay, well, that's a really great question, Michael. And I can answer those questions for you. We wanted to do something very different. Treatment for a lot of people has been pretty punitive, and we want people to be able to live in community, but also have freedoms to make choices, good choices, and sometimes people make bad choices. People are not on lockdown. The expectation is you'll come for a half a day in treatment, and then once you go back, you're back at the house. You have freedoms. You can come and go. You can visit family. You can have your phone. You can smoke outside, of course. And you can have a car. Cars are allowed, but you're not allowed to have your car for the first 30 days because it's so easy to just get in your car when you have a bad day and go somewhere and pick up some drugs. So we want to make sure that they've got to be really secure in their treatment before, or that we have had some good rapport. We know where they are, and then before they drive. We also want to make sure that they're a licensed driver, that they have a driver's license.
That helps.
And that they are insured. Because we're trying to get people legitimate. And if they don't have those things, then those are the things that we will help them obtain while they're in our care.
Oh, okay. So what about, you mentioned before living in community. What does that mean, and why is that important?
Well, living in community that's what, a recovery house is. You're living with other people that are struggling with the same dis-ease that you have. And so, and it's really important that you have somebody that doesn't have chronic mental health issues, because someone who's pretty chronic in their mental health, not to say that we don't treat mental health, and that most of our clients that live in our house are dually diagnosed, but we need people that can kind of function in that kind of environment, because if you have instability in the house, then it can create havoc and have a significant impact on other people's recovery.
Okay. How is this different than sober living?
Well, that's another great question, because we do get a lot of calls for people that are looking for sober living. This is recovery housing, so we are providing housing to individuals that are actively in treatment. And now, if you have completed our high intensity program and you're doing really well and you just need a little more time before you transition, we'll give people an opportunity to stay a little bit longer while they're pulling those pieces together before they transition. Because our real goal, in addition to helping people get sober, is to ensure a really smooth transition, because transition is mission critical. If there's not a good plan forward, then they'll just be right back here.
So what do you mean by transition? What does that entail?
That's a great question. A transition could be what's next for them. Are they going to traditional sober living? Are they going back to their own family? Are they going back to or did we help them secure their own housing? Just making sure that there's a plan, because without a plan, that just sets people up for failure.
Okay. Can people work in this program?
Absolutely. They cannot work for the first 30 days, but after the 30 days, um, let me just back up. It's not really 30, it's between 30 to 40 days on average. And that's if they're coming to their treatment, they're producing, screens free of illicit substances, then they're able to certainly start looking for work. And that's really one of the things that we want them to do so that they can start to save money. And that's why we don't charge people to live in our house, because we want them to start building and saving for their next step.
Right. Okay. Well, that makes a lot of sense. Um, so why would a program like this be good for someone who's just getting started on their recovery journey?
Well, because we have the treatment team in place that's equipped to handle those complex cases and high intensity, because, it is mission critical that we can get people in and stabilized. And I think I forgot your question.
Well, why would a program like this be good for someone that's just getting started on their recovery journey? And it sounds like you have a lot of there's accountability.
Yes.
There's a safety net.
Yes.
Anything else you want to elaborate?
Yeah, thank you. So, and they have a multidisciplinary team.
Okay.
So they have a team to draw from. We have peer support, case management, psychiatric services, medical services. We also prescribe medications to individuals that need it. So, our whole purpose is to really start to not just, address the years that, their body has gone through and the trauma that their body has experienced. We find that people who engage in recovery have neglected their physical bodies. They severe dental issues, other serious underlying medical issues that have gone just
Deferred.
yeah, yes. So we are also, in addition to working with, what brings them to us, right, which is the addiction or the mental health. But then when we get them, we've got this whole host of other things that we have to treat as well. And we do have the people on staff that can help with that can bridge that. We do have a medical provider on site who does help with when we uncover something, whether it's hypertension or infection, we're able to, we work with a lab and we're able to get, labs on these individuals to see what's really going on. Are there STDs that we have to contend with?
Wow.
Hep C, Hep A, AIDS is another thing too. So, and our purpose really is to get them back to the best version of them, to more of a whole state, if that makes any sense.
Sounds like a lot of things to accomplish in that short 6-month time frame.
Absolutely. Absolutely.
Okay, so what would you want, say, a judge or probation officer or CPS worker to know about the program?
That's a great question. I think that they need to know that we are an abstinence-free program, and we are very focused on ensuring a high level of accountability. And, we screen our people a minimum of 3 times a week. And those screens aren't just like a point of care cup, which, you can get over the counter. This is, we send each specimen out to the lab. And what they do is we do definitive testing. So we are really looking at it from a, what do you call that? There's just this next level screening process that it's a little harder to manipulate or falsify,
Okay.
or I probably didn't answer that quite right, but
So, what about folks that have reporting requirements?
well, that's something that we pride ourselves on, making sure that our the that we have good relationships, that we're in partner with them. Now, we're not an extension of the law, but one of the things that we need, our government entities like the courts or whatever, that they can trust when there's a referral to us, that they can trust that we're going to do what we say we're going to do. And if there's any diversion, that that we let them know before they find out on their own. For example, if someone produces a positive screen for an illicit substance and they're on reporting probation, yes, unfortunately, sometimes those results will kind of move the probation in a direction where this client might get violated and and picked up and placed in jail.
Right.
But our goal is to not shield them from natural consequences, because we're here to help people, but we're not here. We have an honest treatment program that we have to run.
That makes a lot of sense. So, what other outpatient programs are available besides these high intensity programs and with the housing and all that?
Okay.
What else?
So we do mental health. We do like medication management. Let's say that someone's been struggling with, let's just say, chronic depression, and they're not really looking for like intensive treatment. Maybe they're just coming into our office, and we're just treating the diagnoses with medication. So we do monthly visits with people that are just, they've been stable on medicine for a long time and they're just continuing their course of care with us. We do diagnostic assessments. We work with, we have mental health counselors as well on site, and we do also kind of like traditional outpatient treatment for people that are struggling with substance use, and we do offer MAT treatment for them as well.
Okay. What about telehealth services?
Yes, we do offer telehealth services. We can offer those services to anyone that is living in the state of Ohio. You can be in Cleveland and meet with one of our providers remotely.
That's great. And what if someone doesn't have insurance? Can you operate on a fee basis?
Yes, we do. We do a fee for service, and I kind of feel like our fees are relatively reasonable for, a diagnostic assessment is about $200. That's for the initial assessment. You're spending about an hour to an hour and a half with one of our providers, and we're, gathering all that data, and we might be also doing some blood work. So I feel like for $200 you get a lot, and then what will happen is then it would go down to $150 a month.
Okay, that sounds pretty reasonable. Is there currently a waiting list?
There is no waiting list. You can call today and have an appointment today.
Okay, well, that was my follow-up question. How soon could someone
Yes.
expect to get an appointment?
Yes.
What's the intake process like?
Another great question. The intake process is relatively easy. Make a call the office, 513-493-0941. I'm not sure if that's our right phone number or not, but
Okay, well, how could someone find out more information about the program?
well, you can look at our website, www.threewatersrecovery.com. It has our hours there. Really, the simple thing is just call the front office and we'll get you in for an appointment.
Awesome. Thank you so much, Melinda.
Thank you.
Very, very thorough.
Thank you.